Good afternoon, everybody. Welcome to today's online webinar entitled 10 EMR-Related Project Ideas for Primary Care, presented by Lee Mantini. Lee Mantini is a registered nurse with a Master's of Health Science degree from Charles Sturt University in Australia. She has worked as a chronic disease prevention and management coordinator for the Prince Edward Family Health Team in Picton, Ontario, and is a primary care nurse at the North York Family Health Team in Toronto. She has used two different EMRs. Lee is the Senior Nurse Leader for the Ontario MD RNAO Colloaborative Peer Leader Program, responsible for program development and coordination of all the nurse peer leader activities. Please note that this webinar will be recorded and the recorded session will be posted to the RNAO website. Please feel free to also connect with myself to obtain the recorded link. At this time, all participants are in listening mode and automatically muted for the presentation portion of the session. There will be an opportunity for asking questions at the end of the presentation, and there are two ways to do so. The first option is to type your question into the chat box on your screen. The second option is to unmute your line by pressing *7 and then asking the question verbally. Thank you, and I'll turn it over to Lee to begin. Just a reminder, Lee, to press *7 to unmute your line.
Thanks, Tanya. So to begin with, we'll take a look at how far we've come with the use of technology in the primary care settings. And then I will talk to you a little bit about the types of projects that me and the nurse peer leaders have come up with that may be able to be used within your practice settings. And hopefully by sharing some of these projects with you, it'll help you what types of projects you could do in your practice. Later in the webinar, I'm going to be asking you to share with us some of the project ideas that you have, some that maybe you've tried within your practice. It could be as simple as a resource that you've put up on your EMR so everybody can use it, or something more like designing a project for a specific population. I'll also tell you a bit about how to access peer support so that you can get from where you are now to where you really want to be with your EMRs. And then I'll open it up to questions after that. So being from rural Ontario, I've seen how old ways have evolved. Old tractors and pickup trucks, they did the job, but it wasn't always easy. It did get the job done, though. Sorry, I'm just trying to switch slides there. And today, the farm vehicles now have air conditioning and GPS, and they're much safer and more efficient because of all the improved functionality. The same thing, come on, turn there. The same thing is happening in primary care. The old paper-based approach got the work done, but it wasn't very efficient, especially when you were trying to look for groups of patients to deal with a specific issue. Sometimes the patients slip through the cracks. Primary care and specialist offices have definitely evolved over the years. There's now about 80% of community-based physicians and approximately 55% of community specialists, and all of the nurse practitioner-led clinics in Ontario have either adopted or are in the process of adopting an electronic medical record. Now we're at the point where we need to start using all the EMR functions effectively to help us improve our patient care and to improve office efficiency, and in the long term to actually improve patient outcomes. So why should we be doing projects using our EMRs? Well, first, Ontario's Action Plan for Healthcare has reached the primary care settings with the introduction of the quality improvement plans. And on top of that, we all really want to do the best we can for our patients. We want to make sure we're giving the best care possible. And we need to continually look at ways of improving how we practice in order to do that. Our EMRs have a lot of useful data in them, and especially about specific populations. And you can use this evidence to help guide the types of improvement projects that you want to do. And the EMR is also a great place to store project data and resources. And having it accessible to the whole team is really useful because then you can compare between offices and whatnot. You can even track your project progress by looking at stats and patient data within the EMR, and the project data collected in the EMR can be your proof that you've actually successfully implemented the project and that you have made improvements in care. So I'm going to talk to you now about 10 different project ideas that we came up with. Some are related to infants and children, some are related to teens or adults, and others are for seniors. I'm not going to give you a complete step-by-step for each project because every practice is different and you'll need to come up with ways to work within your own practice to get the projects to work for you. But at least you'll have enough information in order to decide whether it's a project you may want to consider doing. At some point in the presentation, you may start thinking, oh boy, there's absolutely no way we can do this in our practice. We don't have that time, we don't have the resources, that's totally understandable. My hope is that the project ideas will just spark some ideas of your own that you can try within your practice, that will work within your practice setting. So the first project is an immunization blitz. And with the new immunization requirements for school-age children, everyone's currently attempting to get all their children up to date so they don't miss school. There's a fact sheet on the Ministry of Health and Long-Term Care website that has all the requirements, the changes in the requirements. And so in the interest of time, I'm not going to go over the specifics of the changes. But they are there if you need them. I'm sure your offices have been given the information. So one of our nurse peer leaders did a varicella immunization blitz in her practice to get as many kids up to date as possible with the least amount of disruption in their office workflow. What she did was she did 3 EMR searches to find all the children needing the varicella shot. She first searched the EMR for all the children starting school for the first time and those that are in school that hadn't had their second varicella shot. Then she narrowed the search to the group of children she felt was a priority, and that was the 4 to 6-year-olds, the ones that are just entering the school system. She also did a search for those who had no record at all of having a varicella vaccination. Then she contacted the parents to confirm whether the shot was given somewhere else or not, and then she informed the parents about a vaccination clinic that they were setting up and let them know that their children could be immunized there. So for this project, you could decide whether you want to have set appointment times or whether you want to have a walk-in type of clinic. And it's really best practice that you do have a medical directive when you're giving vaccines within a fast-paced clinic setting like that. And you should also come up with a consistent documentation approach so that the information is easily accessible the next time around when you want to try to search out your patient. Along the same lines, the second project targets new parents to make sure that they understand the importance of immunization and the current schedule of immunization. You could develop a new parent teaching package, which could include the Ministry of Health and Long-Term Care fact sheet and parent guide, and then you could test it out on some of the parents in your practice and get their feedback around what they would like added to the package or what needed to be revised within it. And then once the package is revised, you can actually upload it into your EMR so that everyone in your practice has easy access to it. And this way it saves time and it also saves a lot of space. You won't need that wall shelf with all the thousands of brochures on it that are all messed up because it'll all be in one space in the EMR and you can just print it out as you need it. When I was working at the Prince Edward Family Health Team, we had a respiratory therapist working with us, and we saw firsthand how an asthma action plan really does work for at least it worked for our patient population. The Asthma Society of Canada has great templates for an asthma action plan, and you don't need to reinvent the wheel. You can use theirs. It's very straightforward to use. So for this project, to make sure that your infants and children have an asthma action plan, you just have to do an EMR search of all your school-age children. If you want to do that population, you can pick the age range or pick a gender, whichever you prefer. You can make it the project your own. Then you can identify which patients don't have an asthma action plan, which may be easy if you've never done that within your practice. And you can put a sticky tape or a sticky note or a flag or a reminder, whichever you call it in your EMR, on the electronic record for those patients, and to make sure that you develop the asthma action plan at their next visit. And most likely the children won't have a next visit, so you'll have to arrange appointments for these children to come in so that you can do a teaching program with them and review the action plan with them. So the best way to do it is to actually get the parent and the child together in a room with the physician and yourself. And if your team has a pharmacist, you could bring that person in as well and work together to develop the action plan that works best for the parent, the child, and for their health. And you want to make sure that once you've got it developed, that you print off a ton of copies to send them home with so that they have some to put up on their fridge and they have some to give to the grandparents and some for the teachers and their daycare and all those after-school activities that they do, that everybody should have a copy of their action plan. And that way, if they run into trouble anywhere, they should be able to follow that plan and get the care that they need. And then you always make sure that you arrange a follow-up appointment with them to see how effective the plan has been and revise it as you see fit. Okay, let's move on to the teen and adult population. We have a lot of patients who come in regularly for conditions like anemia or high cholesterol or hypertension, and there's that group that come in for their B12 shots regularly. These regulars are really good for target groups for projects because you can easily identify them and they all have the same sort of background in the sense of their health issue, and so it makes it easy to work with them for a project. Proper nutrition is really important when you're living with chronic conditions, and as clinicians, we're really good at reminding patients to reduce their salt intake or to eat iron-rich foods, but how often do we really do a formal assessment of their nutritional status, especially with our adolescent and adult populations? Unless they're really going to see a dietitian for some reason, we tend not to do a real thorough assessment of their nutritional status. So the Dietitians of Canada have a great assessment tool on their website, and they have many good resources as well. So for a nutritional assessment and education project, you could do an EMR search for a population that comes in regularly. You can pick the one that you'd like, and then do the same thing where you put the sticky tape reminder or sticky note reminder onto the electronic chart to remind the clinicians to do a nutritional assessment and education at their next visit. And you can, in advance, you can pull together your educational resources and get them up on your EMR into one package so that it's available when the patients come in. And you can either call the patients in, or if they've already got a scheduled appointment, you can do the assessment then. And so what you do when they come in, you just help the patient access the Dietitians of Canada's Eat Tracker site, which is really fun, and you should probably do it yourself. It asks a whole bunch of questions, and then it explains where you're deficient in your nutrition and how you can improve your nutritional status. So you can walk them through the website. You can give them also the links to Eat Tracker and Eat Tipster and eatwise.ca, where they can then go home with that information and take their time and go through them themselves and work through and help to improve their own, taking some initiative to take care of their own health. You can print out the EMR teaching package that you developed, and you can give it to the patients along with those websites. And you always make sure to rebook another appointment with them down the road to see how they're doing with their with changes in nutrition. And if you see that they need a dietitian, you'd make the referral from there. And when you're doing a project, you always want to make sure to review your project data. So you want to make sure that you're entering everything consistently into the EMR about your project patients so you can extract that data and determine how successfully how successful the project was. And I really do recommend that you do check out these 3 websites and try them out yourself because it not only makes you a good role model, it makes you familiar with the sites before you start working with the patients. This next smoking cessation update project is for those of you who have a competitive nature. What you can do is you can start a competition with all the clinicians in your practice to see who updates the smoking status of the most patients during a specific period of time. It could be like a week, 2 weeks, whatever you think is suitable for your practice. Our nurse peer leader worked in a large family health team, and so there were lots of offices to be in this challenge. And so what she did in her office setting was she changed all the screensavers on her computers in the office and put up a reminder to check the smoking status on the patients so that in hopes that her office would win the competition. So there's little tricks you can do, and everybody can figure out their own little strategy on how they want to do this type of project. What she did, she pulled all the stats from the EMR before and after the update challenge, and again a few weeks later to see if the clinicians were still updating the smoking status even after the challenge was over. For an incentive, what she did, she got different colored pipe cleaners or twist ties, and on each of the clinicians' individual phone cords, she tied a twist tie or a pipe cleaner, and each color indicated how well they were doing compared to others. So each color meant that they had reached a certain percentage of patients updated. So there is some work with this type of project because you have to go in and you have to look at the data and whatnot throughout the length of the project, but you can revise it as however you see fit for your practice. She also made sure that she had lots of little prizes and little incentives and whatnot to keep going. At the end of the competition, the nurse peer leader, she did a chart audit to find out the winner, and she did that by looking up the status activity for the lifestyle category and in her EMR. So this type of challenge can be used to update all sorts of things on the EMR, so you can really get creative with this type of a project, and it's also a lot of fun too. So the 6th project. Some of you may already be familiar with the Canadian Lung Association's lung health test, and others may not have used it at this point. So what it's looking at the COPD risk in the over 40 group. In this project, what you can do is you can do a weekly search of your scheduled patients and identify the smokers and the non-smokers. And if the smoking status hasn't been updated recently, then you can put a reminder in the chart or on the schedule to update that status when the patient arrives into the clinic. And you put a reminder on the charts of those identified smokers and ex-smokers to do the lung health test, and you can either provide the link to the test or you can actually stamp the test into your EMR to make it a bit easier. When you're doing this test, what it's helping you do is develop a baseline to assess your patient's risk of COPD, and it'll give you that opportunity to provide some health teaching. And you should also develop a teaching guide that you can upload onto the EMR as well, so that you're doing the whole thing at once. You get them do the test, and you give them the teaching material, provide them with a return appointment, and see how things go from there. I know they sound a lot easier when you're just telling you how to do it. There is a lot of work involved in doing projects, but they can really make a big difference in the quality of care being provided in the primary care setting. So this is the lung test itself. You can see it's quite small, so it's very easy to create a stamp with the questions and stamp it directly into your EMR. It's always good to get permission from the organization that you're taking the tool from when you want to put it up and use it in your EMR. So it's just a matter of either phoning or emailing the Lung Association, just saying this is what I'd like to do with it. Are you okay with that? And then go ahead and do what you need to do. If you haven't learned how to do stamps or templates, we certainly have peer leaders who know how to do that and could help you with that. And I'll tell you how to access them in a little bit. Some of you have already, you may already have a process in place for preventing patients from slipping through the cracks when it comes to preventative screening. And some of you are probably still struggling with finding the best way for your practice. This next project is a pretty basic approach to dealing with overdue screening. And I'll be asking you soon about some of the projects you've done. So if you've done something around preventative screening, it'd be really nice if you could share that with us, because I'm sure a lot of us are still struggling with making sure that nobody does slip through the cracks. So for this project, you could do an EMR search for a specific population or age range of patients who need the preventative screening, and that you can decide amongst your office group. And then you use that list of patients from the EMR search and put the reminder on their charts, like all the other projects, to make sure that they check for overdue screening. And when you do find the ones that are overdue, you can develop a screening letter right in the EMR that will have the doctor's letterhead right on it. So you can just print that out and either send it to the patient, or if you choose, you could even just call the patients on the list and make appointments to get them to come in. And you can use the EMR-generated list also to track to see how many letters and calls resulted in attended appointments and numbers of screenings completed. So it's a very basic approach, and many of you may probably already be doing this type of thing, but it'd be really interesting to hear what others are doing. In the 8th project, we're going to look at cardiac risk assessment. And the Heart and Stroke Foundation of Canada is another great site for tools and resources. And for this project, you can do an EMR search for adult patients that fit the criteria for high risk of cardiac disease, or you could even take a group of adolescents with specific risk factors and do the risk assessment with them. It's whatever you decide on your patient population. Then you use the EMR-generated list that you make of your patients and put that reminder on the chart again to do the risk assessment, and if they don't have an appointment, book one. So it's pretty similar for all the different projects. It's important to pull together a lot of the cardiac health teaching materials and make sure if you're doing an adolescent type one that you're looking for age-appropriate type of materials, and you can upload them into the EMR so that they're easily accessible when the patients come in. And when they do come in, you can help them complete the heart and stroke risk assessment online, or if you're one of the offices who have a little extra money and can put a computer in the waiting room, they could actually work on that while they're sitting in the waiting room waiting for their appointment. And then you can review the results with them and provide them with some health teaching material to take home with them. And then you put a reminder in the chart that you should reassess them again. And when you do give them that appointment, make sure you give them the link to the heart and stroke assessment tool, because oftentimes the patient will go home and think, oh, this is really fun, I should show it to my friend, or I should show it to my parents, and then that will help to get other people using the tool as well. And so when you're doing a cardiac risk assessment, you should really be doing that yearly when they come in for an annual checkup. So I'm going to move on to seniors now. Making sure that our seniors are eating properly is really important, especially if you want them to remain living independently. And for a nutritional screening project for seniors, you can use a screening tool and the resources on Eat Right Ontario. So what you do for this project, you'd start with an EMR search for your frail elderly population or those seniors living in isolation. I call them the tea and toast crowd, the ones that are just too, they're not interested in making a meal, they're too tired, they're not socializing, so they don't feel hungry. That group of people are the ones you really want to try to target for this type of assessment. And you put a reminder on their chart to do the Eat Right. It's called the Nutri-E screen. So you put the reminder on their chart so it gets done the next time they come in, and if they don't have an appointment, you make one. And the tool really helps to identify seniors that are at risk of poor nutrition and those that could benefit from education or referral to the dietitian. With the Nutri-E screen, you can, if you choose, develop an education package and put it up on your EMR, but there's also really good resources that come up once you've completed the screening. It looks at what's missing in your diet and then provides all that information right there on the tool, so that you can just review that with your seniors. You can print it out and they could take it home with them. So you also want to make sure that if you're finding the seniors that are really in need, that you do refer them on to the dietitian for more intensive follow-up. And then you bring them back in and check on their nutritional status a few months later and see how they're doing. Okay, so the final project that I want to talk to you about is around falls prevention in seniors. RNAO does have some best practice guidelines for falls prevention, and in that guideline, it does list 3 falls risk assessment tools. Some are more pertaining to hospital inpatients, but for this project, you could review those tools as well as other evidence-based tools online to decide which one of them you feel would work best for you in your practice. You can also check with other family health teams or other offices and see what evidence-based templates they're using for falls prevention, because there's really no sense in reinventing the wheel. There's a lot of good templates out there. And seniors can have a really difficult time retaining information given to them in the doctor's visits. So it's really important to prepare a good falls prevention teaching package for them and to have that uploaded on your EMR so you can print it out and give it to the patient and the family when they come in for their appointment. And once you have the patient's falls risk established through whatever risk assessment tool you choose to use, you can decide what services and what equipment and what interventions need to take place to help prevent your seniors from falling in the future. And you always remember to reassess your falls patients, especially after there's been a change in their health status or if they've been in hospitals. So that's the 10 projects I wanted to share with you. Now what I'm going to do is I'll give you a very quick overview of how to access EMR support, because a lot of you have listened to other webinars that we've done, and so you've heard most of this already, so I'm not going to take too long with that. And then once I've whipped through that, I'm going to open it up to have you share some of your projects with us so that we can learn from you as well. So there's really no end to the quality improvement projects we can do in primary care. If we have students and residents working in your practice, like if you do have a lot of students and residents coming into your practice on a regular basis, you may want to share these projects with them, because they often have to do a quality improvement project as part of their program. So giving them some ideas might be helpful, and it'll also help your practice. But regardless of the nature of your project, I want to make sure that you follow some specific steps. And the first thing you need to do is start with a good project plan. You need to know who's going to be involved in the project, what you're going to do, where it's going to happen, when you're going to do it, and how you're actually going to go about picking your population and collecting the pre-data and post-data and how you're going to report on your project. You really want to make sure it's patient-centered, and you want to collect good baseline data and outcome data. And it's best to work with a team. Even when you're working in a solo practice, there's usually still 3 of you there. There's the doctor, the nurse, and the administrative support person. So that's still a team that you can work together to get projects done. And you want to monitor how you're doing with your project to make sure that it's running as smoothly as possible, and if you need to make revisions throughout the process, you can do that. And one thing that we tend not to do as often as we should is to actually share the results of our projects, to actually go to conferences and present them and share not only the successes but the not so successful parts, because all of that comes together to give us those learning experiences and the lessons learned that we need so that other people can try the projects as well. So if you figure that you might want to do one of these projects, or if it sparks some ideas of doing projects, other projects, then it would be really important for you to make sure that you've got the help you need to do the project successfully. And so if you're interested in working on a project and you're not feeling comfortable with your abilities to use the EMR as best as it could be to do the project, there's certainly nurse peer leaders available to you, and you get them through Tanya Costa at RNAO. I won't leave the screen up too long, but you'll be able to just go to the RNAO website and you'll be able to get the information on how to contact. There's one more webinar in the series as well, and that's on December 4th, and it's going to be on transitioning from one EMR to another, and you can access that webinar or the registration screen at rnao.ca. There's also the nursing and e-health communities of practice that you can join. The nurse peer leaders post interesting tips and tricks there, and some EMR resources as well. And you can also post an EMR-related question there, and a nurse peer leader will respond to you. So you don't actually have to have an engagement if you don't feel that's what you want. If you just have a question, you can post it there, and we'll talk to you through the communities of practice. And if you just need more information around the peer leader program, you can just look at our websites, either the RNAO website or the Ontario MD website. So now what I'd like you to do is all press *7 and unmute your phones. It may get a little noisy with background noise, but I'd really like to hear from you about the types of projects that you've been working on in your practice so that we can learn from you. So could everybody please unmute your phones?
Hello, Lee. I'd like to share what we have done in our practice setting. We selected all our patients over 50 years old that were due for a colorectal screening. And so we came up with a list, and then we would call those patients to come in for their colorectal screening, but we also did up a package between the nurse and the dietitian, education package, providing them with ideas how to keep their colon healthy, and we provided them with instructions on how to collect their sample correctly, and we found that we had more people doing the samples and that the samples that were done weren't getting rejected.
Oh, that's great. Is there anyone else out there who's working on a project that'd like to tell us what you're up to? Don't be shy.
There was a question online, actually, if anyone's doing a project around UTIs.
Or could you speak up a little bit? I couldn't hear you.
Hi, sorry. There's the question online that was posted if someone is doing a project around the UTIs. I guess one of the 10 projects you were mentioning.
Okay. I know that at the Prince Edward, no, it was actually the North York Family Health Team. What we did for UTIs is the nurses developed a template that they used to consistently collect the data on women who had same-day appointments because of a new UTI. We had a medical directive that stipulated which type of patients the nurse was allowed to see and treat without having to have the patient see the doctor. So we would have the nurse would have their own scheduled list of patients, and all the UTIs would come to her. And we would have a teaching package for them. We'd go through the template, make sure all the data was there, and then all we had to do was print off the prescription based on the medical directive we were given, and then find the doctor to just sign it, and then the patient was sent on their way to follow up with another specimen if needed. And then we just collected data to see how the time difference between having the patient come in to see the doctor to get the treatment and get out, as compared to just coming in, seeing the nurse, getting the prescription, and being on the way. And the patient's satisfaction was certainly very high with being able to just call, come quickly in, grab the prescription, and get on their way, as long as they, we didn't find anything untoward in their assessment. Certainly, if there was, we would send that patient on to the doctor. But that's how we did things with PIs at our practice.
Great, thank you, Lee.
Is there any other questions? Or any other project ideas out there?
It's Shirley from Wawa.
Hi.
I use templates a lot. It really cuts down on your time that you have to chart, and it reminds you what you should be asking and how to have complete charting. We use recalls very frequently for follow-ups as well. For people with diabetes, hypertension, the colonoscopy recalls, we search people by the birthdays when they turn 50 or 40 or whatever age we're looking for the recall.
Yeah, that's a very good idea.
Lee, there's also been another question online.
Okay.
We have used it to see the uptake of the enhanced 18th month visit. We search for all birthdays and within a certain time period, which could mean that they turned 18 months in the last year, and check their chart. So I guess.
Excellent.
Follow up to your point.
Is there anybody else that would like to share some of their projects? Is there anybody that's putting resources up? Is there other resources that we could put in our EMRs that you're using that you're finding really helpful? No? Okay, well, does anybody have any questions? We can tie it up if you don't. I hope that you found this helpful. And I appreciate your attention for this, because I know it's really important to get the quality improvement going within your practices. And since it's going to be basically mandated with these quality improvement plans, it's always helpful to have a few extra ideas on what you want to be doing. Does anyone have anything final they'd like to say, or any questions they have before we sign off?
There's just been a closing comment in the chat line. It just says, thank you. It's been really helpful. So,
great. Well, thank you for attending. I really appreciate it.